Hey Rugs, the Sober Dog coming at ya. Video today is about dual diagnosis, mental health and substance use disorder, drug use, how these things combine make issues worse. They kind of feed off each other. Very serious topic. Not that, every other topic about addiction isn't serious, but this just can be an awful circle of one feeding the other if not treated. Now, dual diagnosis, 8.4 million people in the United States suffer from dual diagnosis, which is, a substance use disorder, drug addict, whatever you want to call it, mental health disorder. These mental health disorders can be, a panic disorder, ADD or ADHD, depression, major depressive disorder, anxiety or, GAD, generalized anxiety disorder, bipolar, schizophrenia, PTSD, post-traumatic stress disorder, eating disorders, and borderline personality disorder. Now, any and all of those, combined with a drug addiction, that's just an awful mix. I've seen it so many times, and I classify as one of the people in that category. After the series of concussions I got in football, I was diagnosed with major depressive disorder after. The one doctor said a little bit of ADD because of the lack of focus after the concussions. I never had it before, and then obviously I'm a recovering drug addict, so I would qualify in the substance use disorder. After my 12 months and 25 days in solitary confinement in prison, that made my symptoms of depression way worse and added an entire new level onto recovery. So these two things combined, 45% of people with, a drug addiction have a mental health disorder. So it's almost half. If one is not, if you don't treat both, it's almost a guarantee that you're going to go back out and relapse. I've seen it time and time again. Actually, right now as we speak, a good friend that was doing great in recovery, everything he needed to do for, working the steps, going to meetings. He did a lot of work at recovery programs in and around town. Was doing a lot of good, great stuff from the outside, but this person has a mental health disorder, something on this list, and was not treating it. Decided that they didn't need to take their medication or didn't want to take it as prescribed. Decided to start skipping appointments with his doctor, and lo and behold, this person's back out in the streets using drugs right now, and it's just awful. Everything looked great from the recovery aspect, except the mental health was sliding the entire time. These two things have to be put together. Now, many people, like I just explained with this gentleman, many of us addicts, we think, we can self-medicate and we know our own situation best. And I guess, to an extent, I know what's going on in my brain better than anybody else, because I know what I'm thinking. But the whole idea of, I'm going to take Oxy for my depression, or I'm going to go buy Adderall on the street and take it for my ADD or ADHD or lack of focus, which is what I did do after my concussions. Buying Adderall up and down at school, and, I would lie to myself and say, well, I need it because of all the concussions and how I can't focus now anymore. And it was a drastic change. I'm talking, senior year in high school, I could sit here and, read 30 pages of a book and tell you pretty much everything I read, versus my sophomore year in college after that last concussion was like I could read one page, and then you asked me what I read, and I couldn't tell you a thing. I would just shh. But that doesn't mean that I know, going out and buying drugs from Joe Schmo on campus, I know how to medicate properly, I know how to treat that properly. That doesn't work. And so many, people try to do that, and it just ends up being an awful mix. Alcohol is a huge one. People with serious mental health disorders are 4 times as likely to be heavy alcohol users, according to the National Institute of Drug Abuse. That's a huge number, and I can see that all the time, and that's where a lot of the stereotypes of the homeless person under the bridge drinking come from. Because many of these people do have serious mental health disorders, don't treat them, and then to cope with it, use drugs and alcohol. I did that for years and years and years, and it's just awful because, I wasn't treating either one of them. I was feeding both of them. The more drugs I used, the worse my mental health got, and the worse my mental health got, the more drugs I thought I needed to use, and also the more mixtures of stuff. Because I would, take Adderall because I would say I had ADD and couldn't focus, and then I couldn't sleep, so then I would drink to either sleep because the Adderall had me wired, and then, the oxys and the dope came into play, and it was all this just awful mix. What also makes this worse is long-term drug use, drug abuse can actually create mental health disorders. Someone who is using crack, heroin, alcohol, whatever for 20, 30 years, they can actually mess up their brain chemistry and create a panic disorder, create a generalized anxiety disorder, a major depressive disorder. Who knows what they've went through the last 20 years living on the street, chasing drugs. I'm sure there's been some trauma and all that stuff. Speaking of trauma, PTSD was on the list. It's a 75% of soldiers with PTSD who said they have seen a very traumatic event during their active deployment. 75% of them admit to regular heavy alcohol abuse. We have a huge problem right now with soldier suicide, soldier drug use in this country, and, we need to help, everybody, to get people treated for both their PTSD and the substance use, because, like I've said probably the 10th time now, if one's not treated the other, they're going to keep feeding off each other. And using drugs long term are going to, usually have some awful consequences that are almost, I can't guarantee it, but if somebody abuses heroin or crack or whatever for a 15, 20-year period, there's going to be some major damage, relationship damage, traumas, jobs, whatever, all that mixed to where it's almost guaranteed some type of anxiety or depression is going to come out of it. But all these things being said, both these things need to be treated. If they are not treated and consistently taken care of on almost a daily basis, it's not going to be good. I know for myself, I have to keep my mental health and my recovery both in the front of my mind daily. What that meant for me specifically, and maybe for anyone out there struggling, is when I went to get treatment at the outpatient I went to, it was one part of the outpatient was drug addiction, the other part was mental health. It was literally half and half of the building. They're doing this for a reason now because so many people are coming in. If they got one, they got the other, and vice versa. But the issues can be treated together in a lot of situations, but there's certain aspects of them that need to be treated separately too. I would go to group for addiction, but then I would have one-on-one with a therapist for mental health, and then at the end we actually had an 8-week mixed group of dual diagnosis, so people with both. But both things got to be treated. An antidepressant, now I am not a doctor, So if you are considering, if you have a mental health disorder or a substance use disorder or both, and you either take an antidepressant or you think you need whatever, please talk to a doctor, professional, medical person. I am not one. For me personally, an SSRI was incorporated years ago and helped out immensely after, again, that series of concussions. For you, do not self-medicate and go out in the street and buy Johnny 2-Times Zoloft and Joey Schmo's Adderall and whatever, Billy Xanax. Talk to your doctor and work something out, because there's a lot of stuff that's controlled substances like Xanax, which almost whatever mental health disorder you have, Xanax can be unbelievably negative, unbelievably addicting, very dangerous to come off of. The withdrawals can kill you. That being said, some people may need it. Again, that's between you and your doctor, but I'm not a fan of them. I think they're awful and do more damage than good. But an SSRI may help. Therapy for a lot of people is wonderful. And dealing with the trauma of your mental illness will probably benefit your recovery too, because the majority of addicts that I've talked to, and I've probably interviewed well over 100 for, other research and stuff for Soberdogs, have some reason they were using drugs in the first place. There's usually like an underlying trauma or pain, childhood trauma, sexual abuse, self-esteem issues, injury, something they never dealt with or are avoiding. So you're probably dealing with that in therapy with your therapist, and that's going to also benefit your recovery, because if, let's say, it was a sexual abuse issue when you were younger, if you come to terms with that with, your therapist and work through it, maybe, some of them cravings to avoid life and try to block out the feeling, their emotions will go away. And vice versa, if you work on your substance abuse. I know my substance use, the more I got high and did dope and did all that stuff and coke and everything, the worse my depression got. So if I was at a 5, for the day, I would get high and go up to a 15, and then when the drugs wore out, I didn't go back down to a 5. I went down to a -2, because now I'm thinking about all the damage I caused, all the relationships I've ruined, who I just stole money from, who I robbed, the withdrawals kicking in, all this other BS. So working on one can help the other, but that doesn't mean only just do one. So again, do your outpatient, inpatient, if that's what it is. Your meetings, if you're part of a 12-step program, have a support network. Make sure they know, what like signs and stuff to look for if you're starting to isolate for depression. If you're on if you are kind of relapsing in the mental health mode, you're more likely to relapse in the drug use mode. But have a good support network. Have a therapist if you need one, if you can get one. If you are on Medicaid, any of that, you could definitely get one. A lot of these outpatient programs work on your mental health. If medication is needed, take meds, talk to your doctor, tell your doctor you are a recovering drug addict, so they know they can work with you on not giving you controlled substances. And I don't think medication is always the answer. It's a little piece of the puzzle. It's never going to cure, any of these things on this list and just make you magically happy, but it can maybe bring you from that 2 to a 5, and then exercise, meditation, therapist, all that stuff slowly brings you back up too. Meditation, praying, if that's something you're into, your higher power, church, groups, whatever. Meditation's great for anybody. Fitness, yoga, these things can help both, substance use and mental health. But the main point, treat them both, and treat them both daily. You can't let one lapse. Please don't. It will drastically hurt your recovery, and it will drastically hurt your mental health. If one goes down, the other is usually going to be brought right down with it. We need to work on both of them And then working on both of them helps them both, and everything increases, but it's a daily thing. So if someone out there you know is struggling, talk to them, be compassionate. Don't just go yelling and screaming. That does nothing. Try to work with them. And, if it is a dual diagnosis with the mental health and the substance use disorder, treat them both. Most rehabs and inpatients and outpatients nowadays are already equipped to treat both things anyway. All right, K-Rugs, the Sober Dog, out. Make sure you hit that like, that subscribe. Help me get more content out there. See ya.